In tonight's Health Watch, doctors in Dallas are celebrating the birth of the first baby in the country born to a mother with a transplanted uterus.
It's being described as a landmark U.S. clinical trial, but there are many issues that still need to be resolved. CBS 2's Dr. Max Gomez here now with more on this. Dr. Max.
That's right, guys. And while this is the first such case in the U.S., there have been 5 similar births already in Sweden. These cases are meant to be temporary transplants, involving either living or deceased donors, with health risks to both the woman and the developing baby. But it's hard to argue with this. Baylor University released video of the birth of the first U.S. baby born to a mother who had a uterus transplant. Doctors delivered the boy in a scheduled C-section.
When you see this boy, you really feel like you've done something beautiful.
There was something about this that was so special. Sorry, I'm an emotional person. There was something so exciting about this because the patients are so excited.
The mother, who wishes to maintain her privacy, has what's called absolute uterine factor infertility, or AUFI, which affects about 1 in every 500 women. She underwent the transplant about a year ago.
As young women, 14, 16 years of age, they're told that they never have a chance of having their own babies and carrying those babies. And this is providing those women hope.
Doctors said the womb came from a living donor who does not know the patient. But unlike other organ transplants, this uterus is meant to be removed after the woman is done having children to minimize the significant health risks of immunosuppressing drugs. Baylor doctors say the baby does not appear to have been harmed by the anti-rejection drugs.
It was sort of what we expected. Immunosuppressive drugs have some effect on the mom. As far as we've been able to tell over 30 years, it's never affected the baby any. And they both did great.
Doctors are currently monitoring the baby and say he is breathing and eating well. The family released a statement saying they hope their son can serve as an inspiration to those struggling with infertility. Now, these transplants are complex. Baylor has done 8 so far. At least 3 have failed, and currently 1 woman in the trial is pregnant. Some ethicists question, though, whether the cost of such a procedure, up to $500,000 all told, is justified when IVF could also produce a genetically related baby by implanting an embryo in a gestational carrier. It's an interesting concept. It remains to be seen sort of how widespread this might be, its usefulness might be.